She's a 4-year-old recently diagnosed pontine glioma.
Meaning?
It's just a particular type of cancer. That's a type of, cancer of the brain in the pontine area. That's the area that's in. They have a 3-month history of progressive. Oh yeah. Yeah, I remember the first one. This is a patient I saw came in with like a month history of just gradual deterioration of mainly walking and simple motor movement. I mean, was doing fine, and all of a sudden, the mom said about a month before I saw him, just noticed little things, maybe not quite as steady on her feet, and not grasping things quite as well. When they came to see me, they were thinking maybe the child was having a little, like they weren't worried about, they thought it was something simple. Well, when I saw the child walking down the hall, I was like, wait a minute now, something's just not right. And so, because at the point she was at, I mean, her gait was so unsteady, I went ahead and sent her straight to the pediatric neurologist. I mean, we just sent her straight on. And when they did the MRI, she had a tumor.
Where's the neurologist?
It was in Fayetteville.
Oh, okay.
So Miss Cody working with me today. What's going on with the baby?
She has been to the hospital running a fever. They told me she ran a fever to bring us to the hospital.
Okay.
And her mouth, the medicines they had her on, they said it put an infection in her mouth, whatever. But she hadn't been taking them, but it was coming back. And I just now noticed something breaking out on her face too.
Okay. So when did you notice the fever now?
That was Sunday.
Which ER did you go to?
South Virginia.
When's her next follow-up up the road?
14th next month.
Okay.
And since they sent her home, they took her off, that weaned her off the meds, and her walking and stuff was starting. It was fine. She had, when she was on going to radiation and chemo, it was fine. She had went back to walking and stuff good, but now it's going back, she can't walk.
So was she doing chemo and radiation?
Uh-huh.
And so now is she doing neither one or just one?
She's not doing neither one.
Okay.
It took them out shoulder.
Okay. All right, okay. Let's take a look at it, okay. Let's look on this side. Open real big for me now.
It's one. It's an eye.
Hold your head back. Open up big enough. Ah. Good girl. Good job. So you can tell how swollen she is. She's been on steroids. I'm sure that's part of her chemotherapy.
Thank you for calling Card Drug at 1. To leave new prescriptions or authorize refills, press 1. To leave a general message, press 2.
Alright, so let me just have the mom call me. And I'm going to ask her one important question here. Let me ask you a question here. I tell you what I'm going to need you to do if you don't mind, because if that medicine was not a Card Drug, when you get home, can you call me back, let me know what antibiotic is?
Yeah.
Okay, that's what I really need to know. And the second thing is, did they recommend a follow-up x-ray for her to check see how pneumonia is doing? Did they say anything about follow-up x-ray? Okay, here's going to be my suggestion, okay? Especially having gone through treatment, I mean, this young lady, you might want to let me run you downstairs on your way out, and let's just repeat that x-ray and compare it to the one that was done Sunday and see how we're doing, okay? The key here is the antibiotic, though, and that's why I need you to call me back.
Okay.
All right. When you were in the hospital up the road, did they have any, did she have mouth sores while she was in the hospital?
Yeah, they said that medicine covered.
And did y'all have anything there that y'all would use when she would break out?
Yeah, it was white medicine.
Was it the magic mouthwash? Do you remember what it was called?
This was like a, put you around the antibiotic. They didn't
Okay.
want to give her other stuff.
It was nothing you painted on, it was just something she took?
Because I asked about that.
Yeah.
It was something.
Now, what are they recommending to use when she has fever? Can she take like Tylenol, not Motrin, right? Just just Tylenol. Okay, okay. So right now the only thing she's taking is just the Tylenol and the antibiotic? Okay, all right. Well, let's do this then. Let's cover our bases, just be safe. Let's run her down, check that x-ray. I can get, the report with the white blood count from the hospital, and then you call me back with the antibiotic.
Okay.
Let's go from there, okay?
Okay.
We'll get that, I'll be right back. Give me 1 second.